Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center, and then to our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as a part of registration remains confidential. Statements of credit will be posted 30 business days after the evaluation closes. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note the evaluation will close midnight Wednesday, September 28th. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that Zoom monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credits. And now I'm going to introduce Teresa and Emma, our presenters for today. Teresa is the Chief Executive Officer for the Roundtable of St. Lucie County and a nonprofit organization comprised of executive-level leaders from the school district, local law enforcement and government, social service agencies, and business. She is also the founder and director of Provision Training and Counseling, LLC, and received her bachelor's degree in business administration from the University of Central Florida. Over the past 25 years, she has worked both nationally and abroad, providing expertise in community capacity building, economic self-sufficiency for residents, youth substance misuse prevention, and juvenile justice reform to achieve positive outcomes from communities. Ms. Bishop supports national initiatives on behalf of federal agencies and national organizations, including the U.S. Department of Justice, Office of Juvenile Justice and Delinquency Prevention, U.S. Department of Labor, Substance Abuse and Mental Health Service Administrations, and the Center for Disease Control. She has served for over 15 years as a master trainer and consultant for the Community Anti-Drug Coalitions of America, and most recently, the Incubated Neighborhood CEO program. And now, Emma Bycraft. She is the prevention specialist at Hanley Foundation, bringing evidence-based prevention programs to youth in Palm Beach County. Emma is trained in the National Registry of Evidence-Based Programs and practice model of Catch My Breath and Mental Health First Aid. She is a seasoned presenter and works closely on the billing aspect of prevention efforts. Emma is currently obtaining her master's in public health to further her contributions to the field of prevention and advocacy. She is the process of obtaining her prevention professional certification and her certification in public health. And now I'd like to welcome both our presenters. Teresa, I will turn the presentation over to you.
Thank you so much, Rebecca. We're really looking forward to presenting this material to you today. Bring your minds into the room where we'll be covering a lot of different concepts, but I think it's very important as we move through this information that you take notes. We encourage you to participate, ask questions. There will be some questions that we'll be asking throughout. Even though you're muted, please type them in the chat box. We will pay attention to the chat box. Ethics is an area that is very, very important to me personally, because in order for us to do well in prevention, we have to be ethical in the work that we do. So I'll start off with our what we have here for you. I just want to make sure that I'm moving my slides properly. Okay. Problems advancing my slides already.
If you want to click on the slide with your mouse, and then
Yeah, there you go. Okay. All right. Sorry, everybody. I'm actually doing that. It's not working. So let me go to the top. There is an advance here. So let me go to the top. Okay, here we go. Thank you, everybody, for the technical challenge I just had. We already had the introduction. So today we're going to be focusing on 4 areas. We want to define for you what ethics and prevention means. We want to have an opportunity for you to learn how to apply prevention code of ethics to your work. And we want you to be able to identify what ethics policies in your organization should look like. And it's even more important for you to be able to recognize and resolve ethical dilemmas as they come up through your work. So we want to start off, and please type in your chat box. We definitely want this to be participatory. We have our first question is, what values are most important to you? And we'll take a few responses there. Please type. Okay, we see honesty. Yes, honesty, respect. They're coming up well. Integrity. I love grace. I love all of them, but grace is important. A lot of people don't understand grace, but when we have folks that are with us, we have to extend grace to them. We'll talk about being culturally competent a little bit later on, but folks that we work with all the time don't always value the same things that we value, and we have to extend grace to them. Equity is essential. It's not the same as equal, but equity. That's a whole nother training in itself. Compassion for the people that we work with. And, we have some staff that engage in compassion fatigue training because this work can be very difficult as we work. We see a lot of sad stories. Sometimes we see things that we're not able to address or handle. Exactly. Being non-judgmental, trustworthy. These are all excellent, excellent values. Okay. Fairness is essential as well. Excellent responses. So just, we want to talk about what ethics is. Ethics is your values plus principles equal ethics. But let's, just briefly, values are our standards of behavior, how we govern ourselves. But when we think about principles, these are the rules or the beliefs that govern our behavior. That's key. These two together equal ethics. And so it's important for us to apply ethics in prevention services across the board to the best of our ability. So I'm going to ask for another response here because I want to make sure that you all stay awake. What does it mean to you to be an ethical prevention provider? I'll take some responses. Knowing your own limitations. That's excellent. putting the needs of the clients first, being professional, understanding people, and knowing your limitations mean that sometimes you might have to seek consultation. Confidentiality. Oftentimes folks share with us stuff that they don't want anybody else to know, and they got to be able to trust us. Because if you get one person not to trust you, it can go out into the community and folks will say, you know, you don't want to communicate to this individual because they'll tell your stuff. And we've heard that before. You know, we need to be thinking about maintaining training and our best practices and laws. Highly important. We're definitely going to touch on that. And I see a long comment here from Merlene. Being culturally relevant and competent is important, and being up to date with current research. That's key. Our field is ever evolving and ever changing. And in order for us to be ethical in the work that we do as a prevention provider, we have to stay in front of the newest and what the research is saying. And it's very, very important that we stay current. We want to be true to our hour and our mission. Yes, you want to be true to your mission. It's important even when you're working in your organization. What is the mission of your organization? Sometimes we can get off track, but as we're being ethical in the work that we do, it's so important that we stay true to our mission. We have our own mission in terms of how we care for people, but the mission of the organization is important. Then I see a great point here from Paige. It's important for you to set the tone for all of your relationships that you're engaging in, whether it is personally in your office or professionally in your office, as well as the community as well. Very nice. So when we begin to think about those areas of what makes it, how important it is to providing ethical services, there's pretty much three areas. It's commitment to our organization, then it's commitment to our public, then it's commitment to our profession. Let's explore these further. So when we think about the commitment to your organizations, you know, when you came on board and you were hired, it is our hopes that when you came on board, that you were committed to the organization and that you were going to provide the services in a way that is going to reflect ethics and be ethical about the work that we do. And then we also want to be sure that as we provide these services, and it came up in the chat, that we do this in a reputable and respectful way. This is key because our reputation is important in the community. And that can make a difference between if people will seek your services or not. And that's important. And so there's many aspects to that, and we'll be talking about that throughout this presentation. What are the elements in your organization's code of ethics? So that's a question, you know, if you would mind responding to that. What are some of your core elements in your organization's code of ethics? And then if you say it's not clear, that's okay too, because that might be an area that we want to be clear on. You know, what is our organization's elements? Transparency, honesty, and integrity. Yes. Boundaries. Yes. 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 Excellent comments here. Integrity, diversity, providing a safe environment. Yes. Respect to staff and stakeholders. Stakeholders are key. You know, I do work with a number of organizations. I'm serving on the board of directors of one of our mental health organizations, and it is important that we have a good reputation because stakeholders, once stakeholders find out these are funders, these are other partners, strategic partners, if we're not really managing our reputation properly, it can turn the community off. And once again, you become ineffective. Even though you might have your heart in the right place, it can become ineffective. It's important that we have a number of those items that are coming up on the screen. Observe the chat because we have some great responses that are there. But fostering and maintaining community partners are key. It's definitely key to funding. I'll put that out right away. That's very important. You know, I'm able to do a lot and ask for funding because my staff operates well in the community and people want to invest in the work that we do. And so that is important for us to consider as we're moving forward. Next, thank you for the responses. So then our commitment to the organization, we have to be committed to serving the public to the best of our ability. We want to have the best environment for folks to come in. Just because we're providing mental health services doesn't mean our office needs to look like whatever. It needs to be welcoming. We want to be able to think about prevention services in terms of public health. And so we also want to make sure that our communities trust us, that we're working in their favor, and they're not by themselves. Very important. So my question now is, with your commitment as a professional, is, how do you choose this career? I chose this career for main reason is that I have lived experience, and sometimes we want to do our own self retrospection and think about why are we here? Because some, to be honest, are in this field. It might not necessarily be what makes them happy or makes their that inspires them. This is important because sometimes we have individuals that might want to identify that this is not the field for me and it's time for me to exit. And that's part of being ethical as well. You got to be able to. Okay, so I'm sorry, we see some comments in there about the chat, folks not being able to see the chat, but we can keep moving with that. Are you able to hear me? Because some are saying that they're not able to hear.
I can hear you on my end, Teresa. Just
Okay. All
I can
right.
hear you.
Okay. So it might be might want to check your speakers. Moving on. Thank you for that. And so finally, when we think about prevention professional, it is challenging representing yourself, the data, and the information with validity that's essential to the work. And now I'm going to segue to my partner, Emma, and she's going to start with, what is your role as a prevention professional?
thank you,
Emma?
Teresa. Yep, thank you, Teresa. So as Teresa was saying, we all chose this profession for a reason, right? So I want to know, what do you guys do? What is your profession? Where do you fit in the world of prevention? Tell me your titles, your careers. We want to get to know you too, because we do want this presentation. We already can tell it's going to be interactive. We want to talk to you. We want you to be able to use your examples from real life to get your questions answered as well. See them start coming in. Case management, prevention specialist, okay, a counselor. I see some advocates. Oh, those came in real quick. They all slid to the back. So volunteer, prevention specialist in schools, social worker, case management, prevent pop and life skills, okay. I'm familiar with that. Outreach, prevention, and facilitator. So thank you all for sharing. So as you can tell, based off just the responses, and they keep coming in, which is amazing, I want to say thank you for participating. So as you can tell, we all come from different backgrounds. What we do in the work of prevention looks different for all of us. So what's important to know is that no matter what level of prevention we work in, that we are practicing ethically. So when we're looking at whether you're at the tertiary level, you're maybe making the laws, the advocating for people, making sure we are doing that ethically. Even if you're not the one coming in direct contact with people, you want to make sure that the things you're putting into place and the regulations are going to have a positive impact on the communities you're trying to help. Whether you're in secondary, you might be intervening with the appropriate measures for that population, for that individual even. So I'm sorry, for tertiary, I apologize, I'm going too fast for me. I was talking about tertiary, if you're the one's direct clients, you're speaking with those clients directly, you want to make sure you're having that impact on those people that you might be helping and assist through a substance use disorder or a mental health concern. You are having that direct client interaction. With primordial, you're the ones that are going to be putting the ones into place, advocating for people. So you want to make sure that you are advocating ethically for those people, those individuals that are relying on you. And then with primary and secondary, you're having those interactions with groups of people, those populations, and we want to make sure that we are putting appropriate measures into place. So no matter where you fall on the level of prevention, I think we can all agree, and based off of everything amazing that you've said in the chat so far, we have one goal. We want to help people. Like Teresa said, and I saw someone put in the chat too, this profession found you, right? We all chose this for a reason. So being able to know that that is our end goal, no matter where we fall on this, being able to help people build up our communities. So we want to make sure that, and that is why it is so important to be able to act ethically in our communities. So when we're looking about how to practice ethically, so we can see that we all have different values. As we talked about, your organizations do have code of ethics. If not, like Teresa said, that's something to identify, right? But we want to make sure that as we all have different values, different experiences, different principles, that can definitely shape people to have different ethical standards for themselves. So we want to make sure in our profession that we are all practicing with that same ethical standard. So that is why the National Association of Prevention Professional and Advocates established the Prevention Code of Ethics, because they want to make sure that since we all do have different beliefs, different values, that we are able to practice in our communities with the same set of standards for all of us throughout. So I have a question for you guys. What do you think these 6 guiding principles are that the Code of Ethics, the Prevention Code of Ethics outlines? What does everyone think they are? You can type some in the chat. Confidentiality, okay. Integrity, respect. So we've got 2 so far. Confidentiality and integrity. We're still at 2. Boundaries is one of them. Definitely, they worded a little different, but you're right on the line with boundaries. So you're all throwing out really great ethical principles and standards. So I think the only, yep, I got competence, that's one. Confidentiality, right? So you are throwing out these great ethical standards, and they are, right? Those are all people's ethics, what they believe, their values. So when we're looking at the code of ethics, though, there are only going to be 6 that they define in it. But remember, some of them, they don't have to define we should act that way anyways, like being law-abiding, different terms like that. That is how we should present ourselves. But there are 6 that they go ahead and outline. So like I said, we got competence, we got confidentiality, someone said integrity. So someone also said like establishing relationships and boundaries. So that kind of does go into one of them. They just refer to it as nature of services. But non-discrimination, we have being and having ethical obligations to communities and societies. So they are established, like we kind of talked about a little bit already, because of the fact that they want us to, and this is how they expect us to act in our profession. And someone put consider personal and professional reputations. Yeah, definitely. And that is a lot of where these different things can fall into. So no matter where you fall into the level of prevention, where your line of work falls in, they establish these so we can be the best prevention professionals that we can in our organizations and in our communities. Without these, like we said, everyone has different beliefs. They might be acting differently. So these are the kind of standards they want us to hold us, to. And I know, like we said, that there was a little bit of a trick when I asked you this, because there are so many different ethical beliefs and ethical standards that people do hold themselves to. But these are the ones that they kind of want us to follow and expect us to follow in our line of work. And I will turn it back over to Teresa.
Thank you very much, Emma. So let's unpack these. First, we want to look at the whole notion about discrimination. So what are the protected characteristics regarding discrimination? Think about some of the groups that you serve or what you know professionally about protected groups that we do not want to discriminate against. Sex, color, HIV/AIDS, disabled age, sexual orientation. Nice. We do have to watch the words that we use. That's big. A lot of times we don't know we're doing things subtly. substance abuse versus substance misuse. There's been some discussion around what the terminology is around that. Okay, even pronouns. Some believe in that, others don't. Whether you believe in it or not, when we're respecting our clients in that space, we have to respect who they are and how they're showing up. Okay, so here are some protected characteristics. Thank you for that. So when we think about being a prevention specialist, we don't want to discriminate against anybody. We want to make sure that the folks, our recipients, our colleagues, other stakeholders don't feel that from us. And so the definition, you have a number of them in there, but you mentioned many of them. We have race, religion, national origin, sex, age, your sexual orientation, your gender identity, economic condition, or physical, medical, or mental disability. These are the very specific categories that we want to be mindful of. And as we do that, someone mentioned earlier about you got to be careful in the use of words, which makes me think about what we have here for you now. Why is non-discrimination important? And what can discrimination look like in your prevention roles? And one of the examples that we came up, when we interact with people, some things we do, we might not think as offensive. I actually had an instance where my staff came to me, who are primarily staff of color, and they do a lot of work in the community. And they came out to a community event, and one of the stakeholders just looked at them and said, "Who let these rebel rousers in?" Well, my staff played it off, but they felt like, why are they labeling us as rebel rousers? We're here as professionals to communicate to this discussion here in the room. So of course, as a CEO, I have to find a subtle way to address that with the stakeholder because they were offended. So when we think about discrimination, and that was somewhat discriminating, discrimination is, you setting a group aside and talking to them and speaking to them differently is one way you do that. So that's one of our actions. So they felt a little uncomfortable when they came into the space that, they typically had not been invited in normal circumstances anyhow. And that was something that we had to consider. So there's two types of discrimination. And one of the ones I mentioned, there are intentional, and then there are some unintentional. All right. So we have to be aware, we have to be self-aware of not only us, and if we're working in the field, as we're working in the field, we have to pay attention to what's going on with our peers as well as they're treating the clients, because we're responsible together as an agency, and how you handle it internally is another discussion, but we do have to be mindful of that. And so I'm going to start first with some intentional. Please list to me some, what we would think are some intentional ways of discriminating against people. Religion and political beliefs. Nowadays, that's almost the same. It's been a blurred lines, and name calling, being rude, making racial slurs, refusing services. These are obvious. These are overt. Not providing service to a specific ethnicity, using racial slurs, derogatory language, profiling. Sometimes we do that and not necessarily know that we're doing that. Sometimes our rules and our policies would do that. And someone mentioned earlier about ethics is that you do have to be cognizant of your own limitations, because we, even though we are professionals, we still bring us to the table as an individual. You still bring you to the table. And sometimes we do have our own biases. There's a lot of discussion around that, but I will be quick to admit that sometimes I have biases. But when they show up, I recognize them and I check them at the door. Sometimes it's hindsight 2020, because sometimes I'm thinking about conversations that I've had to see if I might have said something or done something unintentionally to do something, or sometimes it is intentional because you're having a bad day, but that's not ethical. And so that sometimes can be something that we have to address as a professional. We have to minimize that. Language barriers. You can trigger someone if you discriminate and cause a bigger problem. So what about some unintentional ones that we might do? Think about that for a moment. Some unintentional discrimination that we've done. Not knowing what's permissible to a person, like touching of their hair, touching a person, asking personal questions. You know, it's interesting the other day, I sometimes as an African American woman, part of what I do to celebrate my culture is sometimes I might wear a wrap on my head. And I was at a meeting the other day and I had a wrap and it was a nice little twirly in the front. And I had some folks say to me, "Are you going to a party?" And I thought, this is very important to me. And no, this is not a party garb. This is a part of who I am, but they didn't know that. So we just have to be mindful about even our sly comments. Having staff that is not diverse, that's unintentional. Sometimes it's intentional, sometimes it's unintentional. Sometimes some of our requirements for our job applications may unintentionally do that. Sometimes there are job positions that only require maybe an associate's degree based on the level of difficulty. But, there might be a bachelor's degree that's placed on that job position. And a number of people are criteriaed out, people of color, people who don't have means but have something to bring to the field. But because they don't have a bachelor's degree, they're not able to serve in that position and people are not willing to bend the rules. Making assumptions is unintentional. Absolutely. And I think someone mentioned too, it's sometimes our rules and policies, we have folks that, people who don't have a lot of means, sometimes are working 2 and 3 jobs, but they need the services. But we only set the hours during the day and they get off work at 6 o'clock all the time. Our hours causing certain segments of our population not being able to access our services. That's a question. And many of our organizations don't want to bend in that area. So you want to think about flexing your time and doing a number of other areas to support that. Dress codes are very important, but we have to be mindful that our dress code doesn't discriminate against others. It was a long time that braids and cornrows were not accepted in the workplace. And there were people who actually got fired behind that. And so we have to think about, as folks bring what they have to the table, is the way they dress something that we discriminate against by our policy? We have some that, it's in their culture not to cut their hair. They wear their hair long. They don't, but then our policy is saying, well, we need you to have all of your hair cut. That's one thing if you go into the military, but is that really reasonable? Does that really interfere with your service of delivery? So that's something that we have to be very mindful of and examine very, very closely. We want to also, I see a couple of others, only acknowledging or understanding views, experience outside of your own. And that I even have to be mindful of that because, I bring who I am to the table, but I have to make sure that I am paying attention to all people and making sure that I accept their views or at least acknowledge their views and allow them the opportunity to be involved in a meaningful conversation. Okay, and I think one other is important, holidays or religion. That came up big for me, and I just use again as an example. I had one agency that I knew that many of you know that we're celebrating Juneteenth now. And Juneteenth is a very important holiday for the emancipation of slaves. And it happened to fall on Father's Day. And this organization had a sign on the door on Sunday, even though, they're open partial hours, that said, "We're closed for Father's Day." What organization closes for Father's Day necessarily? And so that was really a slap in the face. And so those are some of those unintentional areas. So let's move on. I'd like to give concrete examples. And so when we think about cultural competency, what is key, as we mentioned here, is the need for us to be self-aware. We have to reflect. We got to know our own biases, even our own beliefs. It's very important because that filters how we see people. And that's also understanding our limitations. We have to understand what our limitations are and be aware of them so that we can do what we need to do to be ethical in the workplace. It's also important that we do our education. Research cultures that you're not familiar with. That's easy to do. Mr. Google is great. Whenever I'm going to work in a community, I have had an opportunity to work all over this nation, from Indian country to very rural areas to working with where the Quakers are and the Mormons. It is so important before I go into providing prevention services or training or whatever, that I not only do a little bit of research as I am looking on the internet about the different cultures and the different mores. I'll ask some of the key leaders too there to help me to understand what's important to you, what's not important to you. What and how do we celebrate you? What are offensive to the folks that you represent in your community? So education is key. And as a prevention professional, it is important that we do our homework in that area because this is another key to ethics. And then we have to be able to interact with diverse groups. You know, sometimes it is can be a little uncomfortable if you're not used to a particular culture. You know, it was interesting for me to work in Mormon country. I didn't know what to expect. Working in Utah, had a wonderful time and got to know folks. And a lot of thoughts that I had and thought were not what I thought. And so I had to be quiet first to kind of move around. And the same thing when I went to Indian country and worked with the Cherokee Nation. And I didn't understand completely, you know, what the religion was. And for many of the Cherokee people, I didn't understand some of their mores and how they respected nature. And so those are things that I had to learn. So it's very important that we have a good understanding of what those things are. Okay. I see a comment in here. What do we do when a kid comes to us and express their gender and it's not traditional? And it's not traditional. Are we supposed to report that? I'm wondering because the law says that we're supposed to report that. That's a sticky conversation for me because we do have laws on the book that says we're supposed to report that. To be ethical, what does that have to do with ethics? Why do we have to report that? But if it's the law, it depends upon what your agency is saying that you have to report. That's unfortunate because what happens is when you, we actually have a community that in the north part of Florida, and I hope I'm not speaking about your community, I may be, that if there is a child who's transgender, all the parents that kid, the children that are in that class, their parents are supposed to be informed. So we do know there's some unintended consequences. Oftentimes, folks don't realize that the transgender population is really, really treated poorly, even by other folks in the gender community, and have suffered murder and have been killed and been targeted. And so now you don't know who these parents are, and you're putting this information out. What about the confidentiality? And so I love that piece. Does this become confidential? If they're coming out to you and explaining that to you, if you divulge that information, it sounds like it's a breach of confidentiality to me. But that's something we have to continue to explore with our organizations and determine how we navigate this in this current environment. If someone tells me that they killed someone in confidence, I keep that confident, but they broke the law. Well, you know, we might want to take a look at that because I believe if there is something along those lines, I mean, that's not about client attorney privilege. If there's been a law or something that's come about, we have staff that work with gang members in the community. And there's a lot of stuff that they keep confidential. But if they broke the law and they murdered someone, then they have to report it to our supervisor. And that information has to go forth, and you have to tell them, I'm sorry, I have to communicate that to our supervisor because of the importance of it and the magnitude of it. We will work with the person to speak about themselves, or if someone plans to kill someone. Again, those are those things that we have to report to the proper authorities so that they know what's going on, because there could be literally blood on your hands if you don't report that. And so those are some excellent questions that we're asking here. I'm going to, for the sake of time, I'm going to move forward. So when we think about cultural competency, what are some things that you have done within your organization to promote cultural competency over the past year? Trainings, workshops. I can see your chat. I see from Edris, I can see your chat, ongoing trainings. Of course, reading articles and having collegial conversations and trainings. I see some that are mandated to do that. Involvement in various events. That's important when you move around and move in and out amongst the people. That's how we get to learn other folks. And oftentimes our walls will go down. And we learn how we can be culturally competent. And let me just say, the field is really moving towards a term more like cultural humility, because cultural competency is a destination. And I want to just encourage you that no one is 100% culturally competent, but through our self-awareness and awareness of others and our education and growth, we humble ourselves, even though we have beliefs and standards and things of our own personal nature. This work is a labor of love. We're trying to help people. A lot of folks that are disenfranchised have mental health issues. Many of the people that we have mental health issues that are coming to us is because of some of the issues that we might discriminate against or have been discriminated against. And so this is important for you to be able to do the work. Hire culturally diverse staff. I think that's key, but I don't want people to say, well, you know what? I've hired, we're serving a lot of Latinos, and so we've hired Latinos. Can I just say to you, we have to make sure that they're culturally competent too. You can have individuals who are the same color or the same race and have their own biases because they may have come from affluence. And so we have to still check that person. We have to really see, is it, you can speak the language, but, what is your perception of the population that we're serving, that you are also part of the community? Something to think about. So someone mentioned here, so when I work for another agency, I use my race of characters, Santa and elves, and displaying Christmas decorations. That's being inclusive. So folks can see what they look like. Some of the things that we do in our organization is that, even if you can potentially see a picture that's behind me, there are two different races there. It could be construed as, two different groups of people. And so even going through our offices and our walls and what we have, is it inviting? Does it look like it's inclusive? So with that, I want to go ahead on and segue over to Emma to talk to you about what the Code of Ethics definition of competency is. Emma?
Thank you, Teresa. So I want to leave this up here for a second. So this comes verbatim, exactly out of the Prevention Code of Ethics. I want you just to take a moment, kind of take it all in, read it, and then I want you to type in the chat, what does being a competent professional look like to you? Or what does that mean to you? How do you maintain or improve your competency? So we kind of talked about how people already mentioned that you guys had really great ways too that you improved your cultural competency over the year. So how have you done it with any other forms of your competency too? Because it doesn't have to always just be cultural. That's kind of a part that plays into it, right? So you've been mindful, okay, to keep some things to yourself. That's definitely the hardest, right? Sometimes keeping things to ourselves. I will be honest with you, my supervisor tells me all the time my emotions show on my face, so that's something I have to worry about and being more competent with that as well. So trainings or travel, yeah, so past experiences, definitely. So you'll see in that definition, right? It does talk about the knowledge that we bring to the field. That is what it means being competent. But also, I love that someone brought up trainings because that's the point I love to bring up too. You're all on a training and we're glad you're here this morning. So that is the way you improve your competency so you can continue to grow in the field. Strive to be helpful, remove barriers. Yeah, definitely. Learning about the client background. Okay, so yeah, making sure you're knowledgeable about the people you're helping, right? You can't go into, and I'm going to talk a lot more about that when we talk about applying these to the prevention framework. You can't go into a community and not be from the community and be like, I know exactly what's best for you. You have to be able to be aware of their backgrounds, where they're coming from, and meet them in the way. That is a part of being a competent professional. From personality, definitely. So education, awareness, information sharing. I think that's a really good point to bring up too, is sharing the information, sharing your knowledge, whether it's with your colleagues, other organizations, being competent so everyone can help improve themselves too. So that I love that you brought that up, sharing information with other people. Ooh, allow vulnerability. Yes. And when we talk about, what Teresa said, cultural humility too, right? We have to be able to be vulnerable, be honest with ourselves, self-aware. And that's a point I really do love to bring up when we are talking about competency. We have to be very self-aware. What are we able to bring to the field? What is our realm of knowledge? We have to be able to admit that maybe this isn't the right fit to me. I might not be able to provide the best services because that is something I'm just unfamiliar with. I'm not sure how to do it. I will not be able to be the most effective at it. So knowing something's out of your realm of knowledge is really important because you don't want to go into communities like we all have such an impact on the communities and populations we work with. You don't want to go into a community when you know nothing about what you're trying to tell them. You are just trying to, whether it's get the numbers, get the funding, you want to make sure that everything you're doing is aligning with your realm of knowledge. It's not always about that, right? Especially when we are working in a public health field. We need to put the public first. We need to care about the needs and the communities we work in. So being able to admit, yep, this just isn't for me. And it doesn't always have to be on the level of with the communities, right? If someone asks you to do something, your supervisors, anyone asks you to do something and you're not sure how to do it, it is totally okay to say that is definitely not my area. I will not be able to be effective in it. So being able to do that, but also being able to ask for assistance when we need it. It's okay if we don't have the answers, or it's okay if you might be too overwhelmed or too stressed to be able to take on more tasks, but being able to ask and have those trusted people, whether it's in your organization, being more aware, like you guys said, with being vulnerable in the communities, being able to learn about the communities you're working in, that's asking for assistance too, right? You're asking to be able to better understand the people you want to help. And that is going to be essential with being a competent professional in our field. So someone already mentioned staying up to date for trainings, which is one I love to bring up. And when we talk about staying up to date for trainings, that is how we continue to grow. Everything is so changing. They continue to change year to year, it feels like. But being mindful that we're not just staying on the trainings and turning our cameras off. You guys don't have your cameras on, which is good, but I hope you haven't walked away from your computer and you're still with us. But when you're doing these trainings, when you are engaging in these trainings, these webinars, the DCF train. Oh, you're here. Thank you. I love it. I'm glad you're here. You guys have been absolutely so amazing participating already. So just joking around. I know you're all here, but oh, thank you. But being able to, yeah, you can't turn your camera on. But when we do have trainings where you have to keep your camera on, or you should, that is definitely, for one way, a great way to stay engaged is if you can turn your camera on. That'll help you be more engaged in the presentation or the training you're involved in. But making sure we're taking that information in. We're not just clicking through the trainings that we get sent out to us that we just have to get the certificate at the end. Making sure we're sitting there, we're taking in that information because that is going to be something that helps you grow as a professional. It's going to be something that allows you to be a more competent professional in our field. because everything is changing constantly. I've only been in the field for a couple years now, but I can already tell you that things have changed so much, right? There's constantly new things that are coming out, whether it's in the way we do things within our organization or just the way the public health field is transforming. So just being mindful and being open to trainings and being open to kind of explore that competency within yourself and being able to admit it's not something you're familiar with, but going through trainings maybe that'll help you become more familiar with those things so you can become a better professional. So like I said, we do have some scenarios. We want also, if you have any scenarios that you think maybe displayed or kind of lacked some competent skills or you want to work through them, we want you to use these chat and the opportunity to kind of do so. So I'll give you a minute to read over this scenario. It's something that could definitely happen in a real life situation. And when you're done reading through this, I want you to answer in the chat. Do you think this is okay? Do you think it would be okay for you to present or implement that program if you're not trained in it? See some not okays coming in. I know some of you are probably still taking it in. And when you answer to me, why isn't it okay? Or why do you think it is okay? For MOU rules, yeah. Okay, so maybe someone could possibly pull it off. But remember, when we're looking at those trainings, right, and we're going to talk about how that these principles apply to the prevention framework. And one of them, and we're going to talk deep about, is fidelity. And we're going to be talking about making sure, though, that people who are trained in the programs know how to maintain that fidelity. Someone who just observes it might not be able to just right off the bat know all the fidelity points that need to be hit in it. So it is tough. It's definitely a tough situation. And we're going to talk a lot about at the end. These ethical dilemmas arise all the time in what we see. So we just need to learn how to work through them. And we're going to discuss that, like I said, more at the end of the presentation today. But it is tough. These are hard. This is, right, our livelihood. We need to do this. We need to implement our services. So maybe having to say no, too. It's not always the easiest. Okay, so maybe if you had someone like the trained person accompany it, yeah, there's definitely ways you could work through it, but the way we should do it is people should be trained in the programs they are implementing or the services they're implementing, because of the fact that some of those, and we're going to talk, most of the services we implement are evidence-based. So for it to be evidence-based, people have to go through those trainings. They have to be aware of what needs to be hit, those fidelity points and all of them. So without that training, someone would not be able to know to hit those points accurately. Yeah, and it can happen too. Like someone or people are sharing, and thank you so much for sharing. It has happened, and that's why I like to bring this one up specifically, is because it's something that could happen so easily because of the fact you need to get it done. You need to get the service done. So learning how to handle that. For those that said it's happened, they are saying sometimes they were able to do it, they were able to present, and sometimes people are saying that they weren't trained in it, so they chose not to. So it does kind of arise a lot, and I'm glad it was relatable to all of you based off the answers in the chat. So being able to honestly have those conversations too can be difficult, right? If you have to tell, especially like your supervisor in these situations, I'm not comfortable, I am not trained in it, I do not have the ability to do it to the best of my ability. I could try, but that would not be ethical, right? You need to be able to make sure you are being competent, and that does, remember, come back to asking for assistance or being able to admit when it's out of your realm of knowledge. So those are some kind of textbook definitions of competency, right? Being able to ask for help, staying up to date on those trainings, being able to ask for corrections. Okay, so sometimes, yeah, people have been trained, so people can provide trainings too. I love that you brought that up when we're looking at being competent, staying up to date on your trainings, and also if your organizations are able to provide trainings within itself, and having those abilities. Like I know we do have people who are like national registered trainers, so we actually have them put on trainings for our organization. Other community members or partners can join. So that's definitely one way to keep your organization competent as well as yourself. And yeah, that's important why it could be a way to cross-train, and that could also be a way to deal with an ethical dilemma, right? Having these situations arise and know, well, this could help prevent it in the future. Yeah, and studying the training materials, yes. So if you are in that situation, right, learning the fidelity points would definitely be the way to go about it if you had no other choice. But remember, to be competent, that would be admitting that you're not available or you're not able to because of the fact you're not trained in it. However, fidelity is, we'll talk once again about that at the end, but it is definitely one of the most important things when we are implementing our prevention services. So when we're looking at competency within ourselves, it can be hard, right? We deal with a lot of heavy issues. I see some of us are talking about being counselors. We all work in that field where we are helping people, and that can put a huge weight or a heavy weight on ourselves. So being able to admit when we're overwhelmed, that is competent. If you know you are overwhelmed, whether it's because you maybe have a personal event going on, you might have maybe something going on outside of work, it could be your own mental health, it could be just the fact that you have so much work in the office, you're just not able to get to what you need to get to. You have to be able to admit that to someone. You have to be able to sit down and have those open conversations. I know I come from an organization, we have a great line of communication, but being able to work towards that communication in your own organization, so you have that comfortable environment where people can come up to you and say, I have this going on, I am not going to be able to help with this at the moment, I can do this though instead, trying to figure out where you can balance it. I know this is very oversaid, but when people say on airplanes, you have to put your mask on before you can help others, because without being able to admit that you're overwhelmed, without being able to say no, you are going to not be able to help others. And remember, that is the goal of everything we do. And I can tell by, like I said, the amazing responses you are giving at right now, that we all want to help people. We all want to make a difference in our communities. So being able to, once again, kind of take that self-reflection, take and examine the things that we have going on in our own lives, because we all know that stuff is going to impact our work. That stuff is going to have a huge impact on the way we present ourselves, also with our populations, with our program recipients, with everyone we interact with. So we have to be able to admit this might not just be the time. I know for me, I present prevention programmings in schools. So when one of us is having a bad day, normally we have another staff member with us. I know that we'll have those conversations with each other because we kind of have that family environment in my organization, which I love so much. But being able to say, I'm really having a bad day today. I don't know if I can do this. I'll work on something else for the program. Can you get up there and present? We do it all the time because of the fact, right, that we have to be able to admit, you have to be competent enough to know that that is not going to, you're not going to be able to get up there and do your best if you're having the worst day of your life. You don't want to take your emotions out on anyone else, right? Your program recipients, your clients, being able to just take that step back sometimes and admit, yeah, I'm not going to be able to give my best ability. My best work is not going to be produced because I have so much else going on. Yeah, and self-care is so important. Self-care is extremely important, and I think that is a way to improve your competency. What are some things you guys do for self-care? Since this is such a helping profession, how do you help yourself? Crafting, drives by the ocean. Yes, Florida has that. That's amazing. I'm an Ohio girl. I love the fact that Florida has beaches now that I'm here. Meditation and exercise. Hair and nail done, yes. Taking vacation time. So being able to recognize the way you take care of yourself. The gym, puzzles, exercise. That's very important though. When we're looking at being competent, you have to know how to help yourself too. And I think that's something that we, as helping in a helping profession, can forget. You might be just trying to help others so much that you start to burn out, that you are not able to take care of yourself. So being able, and the fact that you guys are able to recognize already just so many ways you know how to take care of yourself, you know that is going to improve your mental health too. That makes you a more competent professional all around. So once again, I'll leave this up here for a second. I don't want to read it word for word for you, but this comes from the Code of Ethics definition of integrity. Yeah, I love that someone just put not feeling guilty about it too. that is something that is hard. I know. I'll be honest, once again, I'm really bad at that. You feel bad, right? You want to make the difference, you want to do all these things, but that is part of being competent, is just being able to say no, knowing your own limitations. So not feeling guilty about it will probably come more with time, and I can speak for myself because I still feel that way sometimes too. So just being able to be mindful of that. And once again, it's just being self-aware. So when we're looking at the definition of integrity, so I think it's important that we kind of examine it in a few different ways. So when we're maintaining integrity, we want to do it personally also, not just through our organization, but when we're presenting ourselves and maintaining integrity within ourselves, we don't want to be stretching the truth about things, right? Those are like the definitions of being honest, is definitely integrity, but being willing to volunteer, yeah, that could be a way. And when you're having integrity, that also comes back, like I said, training is paperwork, documentation. Are you presenting everything that you did as a professional with complete transparency? You're not changing things, you're not making things up because you know that's what people want to see. You want to make sure that you are presenting yourself with absolute integrity. And that is, I guess, sometimes hard, and it can also be sometimes unintentional too, as we're going to talk throughout with how some of these, right, we know what it means to be ethical. We want to do that. We are in the helping profession. However, it's not always the easiest, and a lot of times this kind of stuff can be unintentional. So just maybe keeping that integrity within yourself, but also being able to maintain that integrity within your organization. So like I said, with documentation, I know when we talk about fidelity and paperwork, sometimes it can be easy because you just don't want to make the wrong move, you don't want to upset people, but being honest and being able to represent your data, your information, your services honestly is what is going to make you a reputable service provider in your area or in your communities. And you want to be able to be transparent with your communities. You want to build trust within your communities because that's who we want to help, right? We want to go in there and we want to make the difference, but we aren't going to be able to do that if they don't trust us, if they don't believe our data, if they are just going to think we're going in there to make a change, and they might not need what we're providing, right? So being able to have that integrity enough just to know that they are being not receptive of our programs, and we have to be honest about what we provide. We might think we just need the numbers, we just need to get more areas, but knowing if they don't need that service, that's not operating with integrity within an organization or within a community. So just keeping all of those different things in mind. Yes, and receiving the reporting the truth even if it doesn't meet your deliverables. Yes, definitely. So when we're looking at that, you want to make sure that it is honest, right? That is the only way. We know, and everyone knows, with no matter what field you're in, things happen, right? But you don't want to lie. Once again, that's also coming down to maintaining that integrity within yourself. You want to make sure that you are representing everything you do. So even if it doesn't necessarily align with what your deliverables are, your goals, if it's going to be something that you might have to make up because of the fact that something happened, but just trying to build that trust also within your organization and keeping that integrity is extremely essential to be a reputable service provider, to be a reputable prevention professional. You want to be able to be transparent because we are trying to help these communities. We don't want to be providing harm. So when we are not operating with integrity, we are leaving chances and opportunities for harm to be brought into the communities that we so desperately want to help. So just keeping that in mind and being and operating with integrity is extremely essential. So I'm going to turn it back over to Teresa.
Thank you, Emma. Okay, so we have a question for you. What do you think the Code of Ethics definition of natures and services is? But this is a test question. It's okay to take a couple of guesses if you haven't heard of this before. Okay, so this sounds like it's a fairly new definition because, okay, maintaining healthy boundaries. This is new, not a clue. Okay, well, let's go ahead on a reveal. Basically, the Code of Ethics definition of nature of services is do no harm. to the recipients that you serve. It's the nature of your services. We want to be respectful. We want to be non-exploitive and taking advantage of folks and their vulnerability. That is the basic definition of it. And so when we think about how we maintain our relationships with our program recipients, it's very, sometimes we have to really protect our boundaries because there's some people that will cling on to you because that's you're all they have. I remember showing up to places sometime and I would have people say, "Oh, my teacher is coming to see me," or they would want to become really familiar, and I have to make sure that I maintain those boundaries. And when that happens, we have an opportunity to provide services that if we don't do that, we can provide services that expose vulnerable populations. And we want to be mindful of that when we're providing these prevention services, that a majority of the people that we have coming to us are going to be part of a vulnerable population. We want to make sure that we're not engaging in any dual relationship. What does that mean? That means you have a professional relationship on the job, and then after work, you actually have a off-site relationship. Sometimes we come into the workplace and we already have friends in the community. We still have to make sure we're not too familiar. Those boundaries cannot cross if the situation is like that. But we want to make sure that we're not making friends, if you will, or social friends with the folks that we're working with. You lose credibility that way. Also, people will become too familiar with you. What do I mean by familiar? They don't respect your expertise and your ability. And they'll, "Oh, that's just Teresa," because you've become too familiar with them. And so even in the workplace, we have to be mindful of our relationships with authority, staff, and even some of your vertical relationships. Because once again, I'm not saying that we should not be friends in the workplace, but we want to be respectful of one another in the workplace. But when it comes to the recipients, we want to be very careful about treading that line. Because we're caring people, most of us that are in this field, I hope that's why you chose this field. Sometimes it can be difficult not to get attached to the people that we serve. But we want to make sure that we are staying within that line. And I'm staying here for a moment because this has happened a number of times. We've seen it, and we've seen articles in the newspaper about how some exploitation might have happened, or how a relationship with the lines were blurred. It can ruin your reputation. It can ruin the reputation of your organization. And that is not what we want. That's how we want to be ethical as it relates to our relationships with the folks that we serve. And another aspect of it in terms of maintaining our professional relationships is that we don't want to impose our personal opinions on recipients. That can be very difficult at times, right? But we have to make sure we remain neutral. One of the ways that I've learned how to do that is that sometimes people will want you to get an agreement with them. And so sometimes what I have is maybe 3 or 4 benign comments like, "I haven't thought about that. Yeah, that's something that we should consider." But I'm not saying yes, I'm not saying no, I'm not giving an opinion, but they're benign and neutral comments to at least let them know that you're engaged. And even with that, we have to watch our body language, because someone may say something to us that we do have an opinion about. And some of us are more animated than others, and I know that I am, so I have to be very mindful. Do I have my game face on? Look straight ahead to the person, and not dropping my head and not shaking my head. There are a number of body language things that we can do that can create an environment that we're not being professional. And what happens is you can eventually ruin your trust with the person. So I see some comments here. You know, some of these issues, it happens in the schools all the time. There are people who have lost their license. The respect level is always greater if the needs are met. That's absolute. That's absolute. When you're not doing your job, when you're late and you're half doing stuff, it provides an opening for people to get really familiar with you because they can see that you're not even operating within integrity. So that you're asking them to be on time, but you're not on time. You know, there's extenuating circumstances, of course, but we have to be able to make sure that their needs are being met. I love that comment from Eugenio. I hope I said your name right. That was an excellent comment. All of your comments are great, but I'm keying in on that one because as we're ethical and we know our job and we're being professional and we are delivering our services well, it provides a protection for you. There's certain things people won't bring to you when you walk in integrity. There's certain things, there's certain boundaries people most of the time will not cross when you're operating within integrity and when you're operating within a professional relationship. So I have a comment. I have a question for you. Let's do some problem solving together. So a former program participant starts following you on social media and messages. You think nothing of it at the time. Then the number of messages increases and you plan to meet up for lunch one day. It is completely platonic and you just maintain a friendship. Are you acting ethically? See no's. So it looks like it's unanimous. So as a closed-end question, and that's what I was going to ask. Merline did this. This is unethical since the individual was a former participant and the other person is still with the agency. Why? Tell me some other reasons what's wrong with this. Why? What are some elements about it that's not ethical? Even though it's platonic. It blurs boundary lines. It's too personal. You're letting people into your world. It sends the wrong message, particularly when you have vulnerable populations that you're dealing with. You know, sometimes we have folks that are really needy. And so, oh, they're meeting me for lunch. I must mean more to them than some of the other clients. It's unbalanced to the person who's with I see it's unbalanced to the person who's with the agency. Excellent comments here. So moving right along, I want to acknowledge a couple more. It's a power imbalance. Absolutely. Thank you for your comments there. And so when we think about our ethics in our media roles, it is per the Prevention Code of Ethics that we have to remain professional online. To be honest, I don't let everybody on my Facebook. In fact, if they're clients, they definitely not on my Facebook. They may send me a friend request, but that friend request will sit out there for whatever. I might delete it. They might send it again. But my true friends are on my Facebook and on my Instagram. You know, so this means that when you have these kind of guidelines and they're followed, you should present accordingly online. I've had to deal with some of my staff about, now remember, we're in substance abuse prevention here, right? And so I have some of my staff that were turning up martinis online. And if you look at my Facebook, you don't really know anything about what I'm doing. I might post something, that's encouraging or whatever, but you won't know a whole lot about me personally online. And again, that's important to maintain the confidentiality, not the confidentiality, but the professional aspect of you creating those boundaries. And so there are, ethics in social media. And we had to fire an employee because this individual had their political views. So they're their opinions. And they were like, well, I have a right to free speech. And I'm saying you have 3,000 people that are on your Facebook page. They might not be clients, maybe, but they're friends of clients and they know. So again, it's that I see it's important to have that old face-to-face, but that whole online aspect is very, very important. So next, we have a definition of code of ethics in terms of confidentiality. I want you to take a moment to read that. And once you finish reading it, put some things in the chat to tell me what pieces of this stand out for you and why. What stands out? Any part of this definition stand out for you? Prevention specialist, safeguarded confidential. Yes. Disclosure of information. This was, I didn't know that was a job. Okay, it's your duty. Okay. And so when we think about gaining information and exchanging information from individuals, it's so important that we safeguard that. Okay. And we want to make sure that we don't have unsecured maintenance of records. Some of you, if you're working for our managing entity, we have to go through a very specific training around that to make sure that we're safeguarding records and people's information is not going out there. And how do you handle it if it accidentally gets out? Right? So when you work with your organization, it is your responsibility, as we were mentioning earlier about what you divulge and what you don't divulge. What is important to your organization? What are the regulations as it relates to your organization? So here's another definition for you. Take a moment to read this. And then once you read it, some key things that stand out for you here. Yes, information, as you have information, it's on a need to know basis. The big word is necessary. Data shall be limited to information that is necessary. Sometimes we'll enter some things in our notes that, we could have left that out. It's not, germane to what we're talking about. And of course, it's appropriate to the services that you're providing. So in the end, it's very important that we are careful about the maintenance of confidentiality. We got to make sure we're disposing confidential records properly, that we're storing them properly. I had to really assess my organization to see where are our records being kept. Are they under lock and key? We have cleaning people that come into our offices. And they can, it might be automatic for organizations who have to go through any type of evaluation, but other organizations out there might not necessarily know that this is important. Okay, so moving on. So here are some examples of information that needs to be considered confidential. Funding and donor information. Here in my organization, we have 16 different funding streams. We have one funding stream that are private donors. We have individuals that don't necessarily want other folks to know that they're funding the organization because they don't want everybody else knocking at their door. We had a famous football player who gave us a check for our youth conference, our youth leadership conference. And we kept it very close. But he also gave another check to another nonprofit and they were on Facebook, and he had said, "Don't put my name out there." He was on Facebook with a signed check from him, and it wasn't confidential. We also want to make sure that any information, personal information that's uh, related to the client, their demographic information, their personal information is important. We want to make sure that the cost of the internal services are kept confidential. And we also want to think about the operations of an organization. There are some things that we operate in sunshine, but there's some things that are confidential. There's some things that we have to work through that it's on a need to know basis in our organizational structure in terms of how decisions are made. Sometimes when decisions are denied, well, things or services are denied, because you can implicate people. And so we have to be mindful of that. So there are a couple things for us to consider. What are the policies in place within your organization to make sure you're protecting confidentiality? How do you dispose of your documentation? Do you have a system for that? Do you do it regularly? How long do you wait to dispose of documentation? Many of our organizations have a time period of how many years we have to keep records. It's important that you consult with your organization to find out what the standard is for that. What are some things you are still unsure of? And that's a question for you. Are there any things that you're unsure of? Okay. Shredding companies, yes. Are there any other things that you're unsure of? Okay, I see there's some that disposed. They're under lock and key. Your records are lock and key. They're disposed after 7 years. Working from home and separating business from personal on your comp time can be a little tricky. I'm working on that right now because we had the COVID policy that we had in place that we were allowing our staff to stagger. So we had some remote working. Now we have protections in place, mitigation in place. We're not saying the pandemic is over at all, but folks have we're kind of moving around our communities a little more freely. So October 1, I'm ending the remote policy because I think it's important for all staff to be in the office and to resist the temptation of not blurring the lines around business and their personal comp time. And see, this is the whole integrity piece. I was just having a conversation with our operations manager. Even though that I'm the CEO of the organization, I have an opportunity to do a lot of work and do a lot of things. But she will see, for example, I am offline to my organization from 11 o'clock to 1 o'clock because this is the time that we are actually providing this service to the community. I have 2 hours personal leave. I don't have to do that, but I do that to set an example. I do that to make sure even when I have comp time, even though I don't have to report necessarily to staff, but our operations manager knows, I'm offline here. I won't be available. I'll be doing some other things here. So she can actually see how we are working on my comp time. And I'm making sure that I'm not carrying records with names and folks unsecured. And she bought a special container for me for that, so that if I need to be mobile like that, I have a place to store it. It's not in plain sight. So it's very important that we consider those things. The last thing we have here is understand, well, there's 2 more things. We talked about this a little bit earlier. Mandated reporter. When someone is harming themselves or others, including murder, we have to report that. Abuse or neglect at home, we have to report that. Now, sometimes it can be a little difficult, and we have had to find ways to report that in a way that the client didn't necessarily know because we did not want to ruin the trust of that client. We serve some young girls in our organization, And some have come in, have talked about some very serious sexual abuse that is actually occurring right now. And they were confiding in us, and they were afraid for other people to know because they thought they would be kicked out of their homes or ostracized, or it really could have created a serious backlash for that individual. And so we had to figure a way to get that information to one of our superiors. And then the supervisor then contacted the Department of Children and Families, communicated that to them, and in a roundabout way, they just followed up with the home based on the information that they knew, and they worked it from there. But we had to be real careful that there was a buffer between us, unless they asked us to report that, because our integrity and our safety with the people that we're serving is very important. So, last definition. Code of Ethics definition of obligations to community and society. Once again, I'm going to give you an opportunity to take a look at that, because this way I know you're reading it and you're getting it down, and then we can expound on it, because I want to make sure that we're just not talking at you and giving this information, that you're also processing it and pulling it in as part of this ethics training. What stands out for you here? Promoting health and personal and professional stance. We got to continue to have that professional stance. We want to be proactive in public policy and legislative issues. Absolutely. Because there's a lot of things that come down the pike that impact our work, impact our clients, impact the people that we serve. So, this is part of our obligations to community and society. Sometimes it gets difficult on me because of the work that I do. I pay attention to the news. I pay attention to the legislation, and sometimes it's disheartening. I want to turn the TV off, but I'm always processing, how is that going to impact our clients and our participants? What is that going to look like? Making sure that we educate the general public of what they need to be in the know. And I love that, Ayana. And then promoting health in a full circle, just having also all of the general facts of the information. So the Code of Ethics definition of obligations to the community and society is being well-versed in understanding the issues, understanding that the public welfare of the individuals, that they have a right to services, they have a right to personal wellness. They have these rights. And we have to make sure that we take a stance, and sometimes we have to protect even that for the participants that we serve. So with that, I'm going to go ahead on and segue to Emma to continue on to how we look at principles of ethics to the prevention framework. Emma?
Awesome. Thank you, Teresa. So we want to make sure that everything we are doing is going to and learn how to apply this to what we're doing. So we want to make sure that we're learning these ethics, how to practice ethically, how the Prevention Code of Ethics expects us to and sets those expectations for us. And I mentioned a little bit too, like we think some of these, you're like, I would never add someone on social media that was a participant or a former client. But some of these do get a little bit more tricky. So being able to kind of see how it's going to apply to you. And I know the SAMHSA Prevention Framework may not apply to all of you, but certain aspects of it should apply to everyone, right? So I know we have a lot of different fields, a lot of diverse fields in here, but some of these aspects will apply more directly to you. Others will be more indirect. They might be something that is more just one or two of these apply to you. But these are the way we practice prevention services. So being able to implement ethical prevention services is what's extremely essential. Like we've been talking about this whole time, building the trust of the community, being able to have the impacts we want to have. We must apply all of the ethics that we've just learned about, all of the ethics we've talked about to our different aspects that make sure that we are going to implement these the best way we can. So the first step of the SAMHSA Prevention Framework is assessment. So I want you guys to tell me, type in the chat, why do you think it's important to ethically assess a population or a community before you start implementing your prevention methods? So why do you think that's important? Know your audience, yes. Determine the needs. Yes, and that's the one I love to point out too. Your services, they need to address the community needs. To know what the issues are in the community. I love too, someone put understand the barriers to care. That's a great thing to bring up. So not only addressing what the community needs and making sure we are addressing that issue and not imposing our own, right? But making sure that we understand what are the challenges they have. And through assessment, we'll be able to understand what are some barriers to care? Why aren't they able to get these services? Or what are some possible factors that might play into that? So thank you guys, great answers. So we've hit a lot of them already about why it is essential for ethical services. So we already kind of discussed some of these questions. These are the ones that you were bringing up. So what is the actual problem in the community? We want to make sure we are addressing that, right? And we want to make sure where the problem is most prevalent or most relevant is where we are targeting our services to. If we know that there is not a problem with, for example, we'll say like alcohol use at a school, everyone needs to be educated about it still, right? But if we are intervening with intervention services, we have to make sure, right, that they are going to apply to the population we are in. And where is that happening at? Who is the most affected by the problem? We want to be able to target our audience based off of the services we are implementing. I know for us, like we're not going to go into a high school level program with a middle school, right? So making sure we are targeting our audience with appropriate measures. And then what are some things that are implemented in your organization that they have to address some of these problems? What are some things that you know that maybe could use improvement? Do you know if your organization has the ability to address the problems identified by the community? Are you, remember, being competent about your organization, about your abilities in that community? Remember, being competent, right? If it is not going to help the community, if you are unable to provide those services, you'll have to take a step back. If the needs of the population is not met, yeah, people will tune out or disconnect, definitely. And so when we're looking at these, I think being competent is extremely important. That is the one ethical principle I would kind of throw right at this, right? Being able to assess ethically is being competent too. Helps to appropriately assess the situation, yep, and provide services that are applicable. Yes, and the keyword, guys, right, beneficial, right? That's the whole point of everything we do, is wanting to make sure it benefits the population we are serving. So when we're talking about building capacity, which is the next step of the prevention framework, we want to build local relationships. We want to be able to go into communities, and if you're not from the community, be able to build those partnerships. But even if you grew up in the community, you know everyone in the community, making sure you're still building relationships with the people around you. Because once again, we want to make sure that we are ethically doing this, pulling in members of the community. We might be coming as an outside organization, or you might be an outside person coming into this community. So you want to be able to be transparent with them. That is a huge way of, once again, just being operating with integrity, being transparent about the way you can build that capacity within these organizations. Do you think that it is operating ethically if you are only building relationships with the community stakeholders that are all for you being there, the ones that they hype up your prevention methods and your prevention services or your services in general? You're only building relationships with them. Do you think that's ethical? You can type in the chat. I want you guys to tell me why it is or it isn't ethical. Get a lot of no's. Yep. So it's definitely not ethical, and I think that is hard. And it's not being inclusive, right? Yeah, you're leaving out a part of the community and also their needs, because the population can provide insight. Definitely. I think too, if someone has a difference of opinions, I don't know about you, but I love having conversations with people that have different opinions with me, as long as we can have them respectfully, right? Being able to be educated and cross-educated, it definitely, remember, helps build your competence in a whole bunch of different ways. but thinking about the fact that they might have insight that you just weren't able to see. You might have had your blinders on. You might not be able to understand where they're coming from, and they might be able to open that door for you. So I think that is really important. And once again, it can be really hard too. You don't want to have those uncomfortable conversations. You don't want to have pushback. Ideally, we'd all be able to just go in and do everything we want, and everything go fine and everyone support us. But unfortunately, that's not the case. So we have to make sure that we are able to have those conversations, being competent enough in your abilities to talk and have those conversations, but also confident enough in your services, but with that open mind too. That's a huge part about building capacity. Yeah, there's different prevention efforts. It can also interfere with being relatable, definitely. It's definitely important. I like that you brought that up. It's super important. We want to maintain those relationships with the ones that support us, the ones that benefit us. But we definitely don't want to just be forming relationships with the people that support us or the organizations that support us, because we can kind of get those blinders on. We're going to have people in the community that don't want us there. We want to try to at least have those open relationships with everyone involved. Yeah, and try to win hearts, not just minds. Definitely go in with your best attitude, your best faith to try to build those capacity in those communities is extremely essential for our services. So that is engaging with diverse community stakeholders. That's having culturally difficult conversations or making that self-aware. And yep, someone said we all have the same goal, right? So, but we want to make sure our goals align with the community's goals as well. So we're building capacity in a way that is going to be respectful of the communities we're coming into. So when we're planning for our ethical prevention services or just your services in general, right? So when we're thinking about that, those concerns and problems that we found in our assessments, how do we start to plan to help make that difference? So I think a huge thing that we have to think about is considering risk and protective factors in our communities. We want to know what are some of the ways that we can help reduce those risk factors. If, once again, you know you're going in there with a service that it might just not help with their risk factors, it might not help improve. You have to be able to know kind of what are the strengths within the community that you can pull on to make sure that we are implementing or planning to implement, I should say, the best prevention methods or the best methods that we can. So once again, I mentioned, I know before, with being competent and fidelity, we want to make sure that we are planning evidence-based programs and that also it's culturally competent and appropriate. We want to make sure we are going into these locations, these communities, and you're not coming there pushing your beliefs on them or a program that completely counters their beliefs. We want to make sure we are engaging and also just embracing too. We want to make sure we're embracing that in our plan to implement programs there or to implement our services. And then having that open communication with stakeholders. So evidence-based program, I think we all know why it's important. It is extremely important because we know it works. It has facts, it has data behind it that shows that it works. When we are not implementing things that are evidence-based, we're kind of just taking a guess, right? And we don't want to be guessing when people's health, their mental health, all of the different fields are involved. It's not guesswork, right? We want to make sure what we're doing is going in there and it's proven that it is going to make a difference, because that's what we want to do. Understanding too, I know that sometimes things have to become kind of experimental to be evidence-based, but making sure we go around the right procedures if that's the case. If it's not a fully evidence-based program that you know that it is going to, in the process, you're doing research on it, that's a little bit different, right? But making sure we are hitting evidence-based programs because we do know it works. So we want to select the appropriate interventions, right? So we want to make sure that they are going to actually address the problems like we've been talking about, but also that it is going to be culturally appropriate. I know we've gone into some schools that are maybe a little bit uncomfortable with some of the things that might be shared, being very aware, having those open conversations when you're planning those with maybe different teachers or different site locations, knowing what they're okay with being talked about versus some teachers, they want you to have those most open conversations with them, but others want you to be a little bit more reserved or conservative about the information you share. So just being super mindful of your audience, your community contacts, having that open conversation will allow you to select the appropriate interventions for your prevention services. So when we're implementing these ethical prevention services, a huge key comes down to, once again, just maintaining fidelity. And we're going to talk a lot about that. But being culturally aware and competent, once again, just knowing your audience. knowing and being super mindful of what you say, being self-aware, so you know that you are possibly, like we talked about with culture competency, everyone might have a bias, being cautious about the maybe small remarks or things like that that might be said when you're going to implement. And then we want to stay up to date on those program trainings. And once again, not just clicking through the program trainings or turning your camera off and walking away. I'm glad you guys are all in the chat still, so I know you're still with us. But making sure when we are taking that information in for something to be evidence-based, you have to be up to date on those trainings. You have to know what is the most recent thing. They will have different program updates every year, making sure you know what is the new, what is the most relevant thing regarding that program is essential. And when we're looking at fidelity, I know for us examples, we have the fidelity, they have the standards, when they have talking points, they have everything that we need to have, making sure that we know what points need to be hit every time we're implementing a service or a program. And that is extremely helpful because the whole point of something being evidence-based is knowing that these key things that are the fidelity points are hit. That is what makes it evidence-based. So I know for us, we have checklists, things like that in our organization that may be something, if you aren't aware of, you could start doing that. I know we have them, and it definitely helps to, when you're practicing before actually going in and implementing the services, to make it a little bit easier. You'll have it in front of you. You can do practices with it, knowing what exactly needs to be hit, because it can be hard sometimes when you get in the group of things, kind of just losing your train of thought. So having those can definitely be beneficial when we are implementing programs. So another little situation for you. I'll leave it up here for you to read it. So I want you to think about this. If you were implementing a service, would this be, in this situation, be ethical? You can type in the chat and tell me once you're done reading it. And I want you to tell me if it is, why you think it is, or if it's not, why don't you think it is? See a yes coming in. Why is it ethical? I agree with you all. As long as you hit all the points, yeah. And when we're looking at this, you guys are definitely right. So as long as you hit all the points, that's the whole part, is the fidelity needs to be met in the programs you're implementing. I know I was just on a program last week and we had a fire drill in the middle of class. So it was one of those things happen. We know that things happen all the time. Hurricanes, we're in Florida. We're lucky lately, but they are going to be something we deal with, right? So making sure that we are able to implement those programs with fidelity. And if that does meaning being honest on the paperwork, right? If something's interrupted, just say it. And then when we're looking at evaluation, we want to make sure, once again, that the data we are representing is accurate. It is going to be that what happened, it is not going to be modified at all just to make people happy, just to make sure that you are doing your job properly. I know the example I have coming in here is groups of students. We know they can mess around if you work with young people, with kids, and sometimes they do choose wrong answers on pre and post tests, but it's not ethical to change those answers, even if we know they did it on purpose. We know, we see them, we literally watch them just laughing, clicking the buttons or writing it down, but it's not ethical to change those answers to meet your standards or to meet what you need to meet. We want to make sure we are presenting in ethical ways. There's ways to explain these kinds of things, right? So just being honest and operating with integrity. And when we're looking at why unethical evaluations come into play, I'm going to actually turn it over to Teresa again, and we're going to talk about sustainability, but then we're going to talk into ethical dilemmas more and why that can happen.
Thank you, Emma. Great points you were making throughout that. So let me back up to the slide. I'm sorry. And so, first of all, when we think about sustainability, oftentimes people think in terms of money, but it's not always about money. Money is important, but what drives that is, are you able to sustain that service in your community? Not only are you able to sustain, I'm talking about keeping it going. Can you continue to provide that level of service to the community? Or you might be able to scale up depending upon additional funding, but can you keep that going in the community? Can you staff it like you need to staff it? How do you can you repeat what you're doing if you have 12 sessions, for example? Can you continue to sustain that same schedule or sessions? What does that look like? So our goal in prevention is to make sure that we implement community programs that can last, that can be effective in communities. And so why is ethics important in program sustainability? Communities will not be receptive to us. Oftentimes, folks have seen organizations come and then they go, and come and go, or even initiatives that we have. And so sometimes people won't come to the table because they're like, oh, here we go again. It's another initiative. You're doing the same thing. What's different? Right. Sustainability can speak to loss of funding for your prevention efforts. Oftentimes, when our funders are looking at what we do, they're looking to make sure that we're being consistent, that of course, we're operating ethically, that we're providing quality service. And if we're not, and even when some of our organizations are evaluated, right? You might have an evaluator to come onto your site, or you have they have to pay attention to, are you getting the work done? You can lose funding for prevention efforts. I've seen it happen. I always applaud my staff because they make it easy for me to go out and ask for money. They make it easy for me to go to private funders because I can say, look, see what we're doing. And I make sure that our staff understand the importance of operating within integrity and being ethical in the community, because especially one of the controversial programs I have is the implementation of the comprehensive gang model. We have a lot of kids in there that are involved in trauma and so forth. And I actually had one of my staff that had some possession of some arms in their car, even though it was legal. It got back to our law enforcement folk, and I literally had to pull them on the carpet and say, you know, I know it was legal, but the optics are not good. And I had to let him go because of the circumstances. He was out hanging out with groups and a shooting went down and all, and he should not have been in the mix. And it got back. I had to let him go immediately. So when my staff is out there operating, I have to make sure that what they do can affect even our funding, because we get funding from some of those organizations. And, you know, that word gets out that they're not operating like they need, they will run quickly and will work. There will be that small fox that will spoil your vine. And then here it talks about implementing unethically will result in harm to the communities when we're represented, because when people don't trust you and you have a wonderful service, now people are not accessing services. Now you have become a block to that service. And so when we are working in communities, our staff, us as individuals, often run into ethical dilemmas. And what that means is there are things that arise that, you know, really will challenge our own ethics, our own individual morals. And so there are a number of things that influence that. What do you think influence your ethical dilemmas? If you want to type in there, what influences how you make a decision, especially if it's in a gray area, or it might not be in a gray area, it may not be in your best interest. What do you think are some of the things that contribute to ethical dilemmas? Personal interest, upbringing, who might be affected, personal religious values, fear of loss of funding. Yes, these are great. Guidelines for funders and cultures. Excellent, excellent responses. So let's look closely at it as you continue to respond. There, basically, in terms of our individual decision, I say, you know, Teresa says optics need to think of public assumptions. Yes, that's exactly right. Some folks will make some assumptions based on what they see, and we have to be mindful of that. And so there are 4 areas that we want to just bring forth in terms of our individual decisions. Sometimes it's our social influences. I mean, sometimes some of the decisions that we have to make internally, there's optics there. And it's like, okay, I need to really fire this individual, but this individual, I need to let this person go because they weren't operating ethically in the organization. However, you know, they are related to another key person in the community. or they are related to, I've had a situation where I had a friend of mine that knew some friends that, worked in the workplace, and there was a conflict of interest. And I literally said, I don't need you in the middle of that. Let's not discuss that, because it's important that I do what is best for the organization, that I do what's best for the people. So sometimes we will feel pressured by the choice. I mean, I scratched my head a number of times of how do I handle the situation without alienating of the folk, but it was for the good of the organization, and it was good for the people. So, I had to take a blow right there. And so sometimes there's financial influences that was mentioned earlier that may influence whether we make a decision or not. Are we going to do this because there's going to be gain in this, monetary gain? Or are we fair if we make a decision or we say something? And in this environment, I have been overly concerned because I'm always protecting and working for the underserved. And some things that are happening in our environment, I have been speaking up. And I have people that I'm working with on my board, for example, and in my organizations that are on both sides of the aisle. And some of them have the ability to make decisions about whether they'll fund us or not. But then I have to make a decision. Do I still speak up on behalf of the vulnerable populations? Do I still provide perspective? And sometimes there are things that, I may might impact my career. At this point in my life, in terms of protecting the community and protecting the integrity of the organization, I am prepared to take whatever hit I need as it relates to supporting groups that are vulnerable and making statements. Sometimes we sit in a room and we hear decisions that are being made, and we know some of the stuff that is being said is unethical, maybe outright discriminatory, and it might even be racist. And we remain silent because we're concerned if we speak up, then it might impact our career. Well, that's what ethics is all about, taking a stand professionally. And I just believe when you do the right thing, one door may close, but I'm old enough to know another door will open up. And so that is key. And then the last thing is our individual beliefs. We're in a very divisive environment in our nation right now about having attitudes about, the LGBT community, abortion, and a range of, critical race theory. There's a range of things that are out there right now that you can bring to the table in terms of what your values are. And you may be very controversial about what you believe. But when we're working in the workplace, how do we stay in a place that we remain ethical? And how do we stay in a place that we remain, I would say, in a way that we still are inviting and mobilizing the community, even though we have those individual beliefs? I think that's going to that's going to challenge a lot of people, because some folks don't agree with some people's lifestyles and all, but that's not the business that we're in. And what I say, that's not what I'm called to do. I'm called to help the vulnerable, regardless of what they represent, how they represent, what their thoughts, what their feelings are. And so our individual beliefs are in there, but how do we buffer that? And when we are dealing with ethical dilemmas, how do we speak up too, in terms of some of these ethical dilemmas that we have? These are the factors, but keep them in consideration in terms of that. And so, here's a scenario here that I like to just touch on real quick. In order to receive funding for your grant, we've done this before. You're at the end of your period. You have 10,000 folks. You're supposed to have served 9,000, and you know that your colleagues' jobs rely on this grant. Do you pad the numbers, even though you did not actually serve that amount? What do you do? I see a big old nope. No. Oftentimes when you do stuff backhanded like that, it can come back and bite you. I would rather go to the funder, and I would rather go and say, this was our goal. And in most cases, there will be grace allowed, particularly if you have a reasonable reason for that. Example, COVID messed up a lot of our numbers. And so, exactly, Jenna, you have to explain the challenges that you face. And most of the time, you will have an opportunity to explain it away. So you don't want to do that. Yes. Okay. And so, once again, being self-aware of your influences, really think about what influences your decision making, because we bring ourselves to the table. And so we have to think about all of those areas. Is it my beliefs? What are some of the things that we have? And we have a question here, and you can type in as we move. What do you struggle with? You know, of course, I'm one of those that all my life I've tried to avoid being a people pleaser. I don't want to disappoint people. At the same time, I don't want to compromise my own values and beliefs. Sometimes those are the things that keep me up at night. I don't want to be, I don't want to negatively impact my career. That keeps me up at night, especially in this environment. And so, I see folks here keeping a moral positive is extremely important for us. And so, what are some resources you have available to assist you with facing an ethical dilemma? I see someone said that the biggest struggle is separating your personal beliefs. Absolutely. Multiple supervisors, available supervisor. I always have someone, I have a couple of people who have great wisdom that have been in the field a long time. I had a situation that came up that was an ethical situation and how I handled it. And I was on the phone with them 3 o'clock in the morning because they're my mentor. There you go. You want to have some mentors. That's very important that you have someone that you can go to. And so without ethics, there's no prevention services. Ethics is a guide to what we do. We want to make a difference in our communities, but we got to do that thing the right way. We have to do it the right way. There's so many parts of it. We can provide wonderful, wonderful services in our community, but if our ethics, our values, and our standards as individuals and as an organization can be a dilemma and can hurt the field, it can hurt your local community. And so let me just stop here. We've got a couple of minutes to ask. We have some resources here, but are there any quick questions that I might be able to answer here? I'll take one or two, and then we'll have to call it a wrap. I will leave the resources slide up. Absolutely. Let me just move to that to see why we have any questions. This is our resource guide, resources. We have the principles of ethics. Please review that. The Strategic Prevention Framework, SAMHSA has a wonderful guide around that. You have your certification board online. You see a number of resources there. Have that. What is an ethical area you think needs more attention? To be honest, working with the LGBTQA community. Many folks really are having a hard time, balancing their religious beliefs and what else they bring to the table and how to do that. I actually brought in someone to train my board on the various LGBTQAAP. There was a number of them. And it was interesting to see the responses and see how some folks were blown away. And so we actually had an individual who was on the board who walked out of the meeting and said, I can't listen to that. And so that's one of the biggest areas. Remember, our citizens from the LGBTQA community, every community has different acronyms at the end, depending upon what's in your community, are human beings. They need our support. Remember, suicide rates and death rates and substance abuse rates are escalated with our brothers and sisters, and I would say that, from the LGBTQA community. And so that's so important that we think about how do we make sure that we are not doing any harm, that we're not turning people away. It's important in that area get a little bit of training around that. I recommend if you have an opportunity, bring someone in and train you so that you understand that all the aspects of the LGBTQA community. So with that, we just want to thank you for listening. We thank you for all of your participation. It made it very easy. It went quickly. And Emma, if you want to say a goodbye to everybody.
Yes, thank you all so much. It was so involved and you were amazing with participation. I hope it was informative to you and you were able to, like we said, keep involved and engaged with it because of how interactive it was. And we thank you so much for your time this morning. Well, now afternoon.
Okay.
And I just wanted to say on behalf of FATA and everybody, thank you guys so much. It was an absolutely wonderful presentation. I think a lot of people gained a lot and you're getting a lot of high praises in the chat. So I really hope you can see it. And it really was very engaging and just a really great, awesome webinar. So thank you ladies so much. It was absolutely wonderful. And we've included Ms. Bishop's and Ms. Bycraft's contact information so that you may contact them with any further questions. Once again, we just really want to thank you both for all the effort. And I know it's a lot of work to build these. So thank you guys so much for your time and everything. And just please note a couple of items of business before we conclude today's webinar. Please see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your web browser will take everyone to an evaluation on FATA's website. If you would like to receive CE credits or statement of credit for this event, you must complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license and prefix when you registered with our site. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for today's webinar and what you have in your FATA profile system, as this is the only way to connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. Please note the evaluation will close midnight Wednesday, September 28th. Additionally, we do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation. If you do not know where to find your journal entry, please visit our website where we have a frequently asked page that will walk you through that. And again, thank you all for participating in today's webinar, and we'd like to recognize and thank the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. Have a good day, everyone.
Thank you all so much.
Thank you. Have a great weekend, everybody.